Coronary artery disease, also known as coronary atherosclerosis, is the hardening and occlusion of an arterial vessel lumen by fatty plaques in the arterial wall just past the endothelium lining of the artery. Factors that cause damage to the endothelium, such as diabetes, hypertension, smoking, alcohol, and many others, put a person with elevated serum LDL levels at risk for coronary artery disease. Damaged endothelium allows LDL cholesterol to get past the exterior lining of the artery and deposit into the arterial wall. White blood cells, called monocytes, follow these lipoproteins into the arterial wall in an attempt to phagocytize them and remove them from the wall. But when the number of lipoproteins is high, the monocytes eat until they die in the arterial wall, becoming a foreign deposit in the wall themselves. Their death releases cytokines, which attracts more monocytes into the arterial wall, which will also eat as much lipoproteins as they can, and which will eventually die as well, forming a fatty streak. This attracts platelets to bind to it, and they release platelet-derived growth factor that causes smooth muscle cells to move into the fatty streak and form a fibrous cap over it, creating what is called a plaque. Luckily, plaques are not thrombogenic, so platelets don't aggregate around them and blood doesn't clot around them. But if risk factors are corrected, a plaque can remain stable, causing only partial occlusion of a vessel. But if the factors are not corrected, a plaque can rupture, exposing the inside of the plaque to blood, which will end up clotting around it. Which will end up clotting around the damaged plaque, putting the vessel at risk for full occlusion, which would lead to tissue ischemia and death distal to the occlusion, resulting, in the case of coronary artery disease, a myocardial infarction. Signs and symptoms of coronary artery disease are very similar to the signs and symptoms of a myocardial infarction or heart attack because coronary artery disease leads to heart attack. The first sign is angina pectoralis or chest pain, and it happens when the myocardium or heart muscle is lacking oxygen. There are two types of angina. There is stable angina and unstable angina. Stable angina is when your chest pain goes away with rest or nitroglycerin, and unstable angina is when the pain does not go away with rest or nitroglycerin, and it's a serious medical emergency indicating a very serious occlusion of an artery. The other signs are pain or discomfort in your shoulders, arms, particularly your left arm, back, and upper abdomen. There's also shortness of breath, general weakness, dizziness, nausea, rapid heart rate or palpitations, and clammy skin.
So let's talk about the risk factors and prevention involved in coronary artery disease. When it comes to the risk factors, they include smoking. Smoking causes vasoconstriction and damage of the arteries. It also increases your chances of plaques forming within them. Being obese or overweight, having high cholesterol, a sedentary lifestyle, having diabetes, and even a family history of coronary artery disease can put you at risk. When it comes to prevention, that includes modifying your lifestyle and diet, smoking cessation, and when it comes to smoking cessation, it's important for us as nurses to teach patients how to develop a plan and give them resources they can go to. Exercise is also important in prevention, and educating your patient on signs and symptoms of what to look out for and when to seek help are also important.
Diagnostics. Diagnostics for coronary artery disease include echocardiogram, which records electrical signals as they travel through your heart, echocardiography, which is an ultrasound imaging of the heart, CT scan, otherwise known as computerized tomography, helps your doctor see your calcium deposits in your arteries, and coronary angiography, which are x-rays of the arteries using a special dye to help diagnose CAD. Lastly, tests for increased risk for CAD include C-reactive protein, or CRP, a complete lipid profile, and a calcium score screening heart scan.
The most common medications used to treat coronary artery disease are lipid-lowering agents, which protect the blood vessels, antihypertensives, antiplatelets to prevent blood clots, and nitrates to relieve chest pain. Minimally invasive procedures can be done in order to open a blocked coronary artery. Procedures is a percutaneous transluminal coronary angioplasty. This procedure involves temporarily placing an inflated balloon at the side of the blockage. This procedure can be combined with permanent placement of a stent. A stent is a small wire mesh tube which helps keep the coronary artery open. Bypass graft is a surgical procedure done to treat coronary artery disease. A healthy vein or artery is taken from the body and connected to the blocked coronary artery, which will then bypass the blocked coronary artery. This creates a new passageway for oxygen-rich blood to reach the heart muscle.
Here are some lifestyle changes to help manage coronary artery disease. The first one is to stop smoking. The chemicals in tobacco smoke harm your blood cells and can also damage the function of your heart and blood vessels. You can also control your blood pressure. High blood pressure puts added force onto your arteries, making them more vulnerable to the narrowing and plaque buildup associated with coronary artery disease. Check your There are many cardiovascular resources available to you in the San Joaquin County area, including St. Joseph's Heart and Vascular Institute. They offer a full range of services to care for your